Hi, my name's Liam. I'm a worker on the Party Project, the Peer Advocacy and Response Training Initiative, and I run the Sesh Ed Instagram page. This is my perspective on using social media to reduce drug-related harm in young people. I would like to begin by acknowledging the traditional custodians of the land from which I am speaking, the Doodle people, who have tended this land for thousands of years. I would like to pay my respects to elders past, present, and emerging, and acknowledge that sovereignty was never ceded. This always was and always will be Aboriginal land. I feel it's also important to highlight the disproportionate and persistent harms that colonial, prohibitionist drug policies have on Aboriginal and Torres Strait Islander people, who are among the most incarcerated peoples on Earth. Thank you to the VNGOC board for giving me the opportunity to present my perspectives on using social media to reduce drug-related harm in young people. My perspectives on this topic are from managing SeshEd, an Instagram page for harm reduction content, and I do this as part of my role as a peer harm reduction practitioner at Better Health Network, which is a community health service in Melbourne. SeshEd provides credible, realistic information about drugs and strategies to prevent harm from a peer perspective. It's developed by young people who use drugs for young people who use drugs. The aim of SeshEd is to reduce harm, not to prevent drug use. This distinguishes SeshEd from other institutional sources of drug information, which often only focus on the risks of drug use and use stigmatizing messages which may further disengage young people. SeshEd is not promoting drug use, but rather provides information that acknowledges the risks of drug use and the positive aspects of people's experiences to empower young people to make informed decisions about their drug use. Information targeting young people on how to minimize the risk of using drugs is rarely published by educational or governmental institutions. Moralistic messages promoting abstinence and the prevention of drug use are often the only drug-related information provided to young people in schools, causing them to mistrust authorities and leaving them unequipped to make informed decisions to reduce their risk of experiencing harm if they do use drugs. Data collected from followers of SeshEd highlights that young people rarely access traditional health services for information about drugs. Instead, this data highlights the role of peer networks as primary sources of information. Because information about how to protect themselves isn't usually provided to young people, they can easily find themselves accessing potentially harmful misinformation that may then be reinforced through these networks, even if it's done with the intention of keeping somebody safe. There is a clear need and interest among young people who use drugs to have access to information they can use to reduce the risk of experiencing drug-related harm. So we post a range of harm reduction focused content to SeshEd, with the primary focus on substance-specific posts that provide an overview of a drug, including its common effects, information on dosing, short and long-term risks, substance interactions, and practical strategies to reduce harm. The information presented in each post draws on academic literature and a range of trusted harm reduction sources. So the information is then broken down and presented in language that is more accessible to a broad audience. So engaging with our audience has been instrumental in building the reputation of SeshEd as a reliable source of harm reduction information within our community. This involves posting content on topics requested by our audience, which ensures that the information meets the identified needs of people who follow the page. The reach and engagement that we have with our audience makes SeshEd well situated to amplify important information from other official sources, such as high-risk drug alerts published by the Victorian State Government. So by utilizing the style and language of SeshEd, these alerts spread through online peer networks and are seen by up to 40,000 accounts, as our posts are shared by young people concerned for the safety of their friends and communities. So these examples also demonstrate the potential for online harm reduction services like SeshEd to cooperate with a range of other stakeholders to improve access to information that can reduce harm. So how do we know that this is reducing harm? So people sharing SeshEd posts are the online equivalent of information on drugs spreading through peer networks. It's indicative of people wanting to protect their friends, peers, and community. It's also indicative that the information is relevant and accessible to the broader population of young people who use drugs. People saving our posts is also important as it indicates their intention to access the content before they might actually use a drug. This is a positive aspect of posting content online, as people can access it in situations where they may need information about a specific substance that we've already made a post about. While the posts provide information on a topic to a wider audience, SeshEd is also utilized by young people as an online safe space where they can ask questions, share experiences, and seek information on relevant topics. Given this demographic is unlikely to access traditional health services to ask the same questions, this is a valuable function of the page and highlights the importance of engagement and trust when delivering harm reduction services to young people. These interactions have allowed us to provide information about relevant services for people seeking help, and it's also served as a pathway for people to share information with us about potentially dangerous and contaminated drugs circulating in local markets. And perhaps most importantly, we know that SeshEd helps to improve the risk of young people experiencing drug related harm because that's what they tell us. So, in closing, recommendation 32 of the 2021 INCB annual report states that social media are a critical tool for reaching vulnerable groups such as young people, and national authorities should consider investing more resources into the development and implementation of drug prevention programs and activities that make use of social media. This narrow focus of global, national, and local institutions on disseminating information designed only to prevent young people from using drugs does nothing to protect those young people who use drugs. Despite many of the social, health, and economic harms of drug use stemming from prohibition and the punitive enforcement of drug policies, SeshEd and other harm reduction services demonstrate that people who use drugs, including young people, will take steps to reduce the risks to themselves and their community if given the opportunity and information to do so. Thank you.